Imagine going to the doctor, trusting that you're getting treatment for your illness. But instead, the doctors are secretly using you as a test subject. For 40 years. This isn't a conspiracy theory. It's real history. From 1932 to 1972, hundreds of African American men in Tuskegee, Alabama, were lied to, denied treatment, and left to suffer and die, all in the name of science. This was the Tuskegee Syphilis Study, one of the darkest chapters in American medical history. Today, we'll dive deep into the full story, how it began, how it was allowed to continue for 4 decades, and how its legacy still affects trust in medicine today. America in 1932. The Great Depression. Poverty widespread, especially in the South. African Americans in rural Alabama faced systemic racism, limited access to health care. Bad blood was a common term used locally to describe illness, including syphilis. Syphilis itself was widespread, a serious, potentially deadly disease if untreated. In this world, where poor black men had little access to doctors, a government study arrived promising free health care. For many, it sounded like salvation. Instead, it was betrayal. The U.S. Public Health Service, working with the Tuskegee Institute, recruited 600 black men, 399 with syphilis, 201 without. They were told they would get free exams, meals, and burial insurance. But the true aim, to study the progression of untreated syphilis in black men. The men were never told they had syphilis. Instead, they were told they had bad blood. Doctors gave them placebos like aspirin and tonic, but no real treatment. From the very beginning, this study was built on lies. Participants came regularly for checkups and blood tests. They trusted the doctors, believing they were being treated. In reality, their illnesses worsened year after year. These men were not just numbers. They were fathers, husbands, and sons. They lived their daily lives in poverty, working on farms, raising families, never knowing that the very people they trusted to heal them were watching them die. In the 1940s, penicillin became the known cure for syphilis. Instead of ending the study, researchers actively prevented the men from receiving treatment. Doctors contacted local hospitals and clinics, asking them not to treat Tuskegee participants. This is the most shocking part. Even when a cure existed, they weren't given it. The study had turned into something even darker, not just observing disease, but deliberately denying people the chance to survive. Over the years, many men died slow, painful deaths. Some wives contracted syphilis. Children were born with congenital syphilis. Generations were scarred. Real testimony example. Survivors described being proud at first to help government doctors, only to learn later they had been betrayed. Imagine learning that the reason your husband died or your child was born sick was because doctors chose not to help, because they wanted to watch what happened to you. By the 1960s, questions began to emerge. Some doctors inside the Public Health Service expressed concern. A whistleblower, Peter Buxton, leaked information in the early 1970s. In 1972, the Associated Press published the story. The nation was horrified. It took 40 years for the truth to break through. And when it did, it shook America's faith in medicine and government to the core. The study was officially ended in 1972. Lawsuits followed. Survivors and their families received some compensation. In 1997, President Bill Clinton gave a formal apology on behalf of the U.S. government. In his apology, Clinton said, "The United States government did something that was wrong, deeply, profoundly, morally wrong. For the men of Tuskegee, It was too little, too late. The Tuskegee experiment deeply damaged trust in healthcare, especially in African American communities. Even today, some people hesitate to trust vaccines, doctors, or government medical advice, in part because of this legacy. The case led to changes in research ethics, like the Belmont Report and stricter protections for human subjects. This is not just history. It's a reminder that science without ethics is dangerous. That trust, once broken, takes generations to heal. And that accountability is necessary, no matter how uncomfortable it makes us. For 40 years, hundreds of men in Tuskegee were lied to, denied treatment, and left to suffer, all in the name of science. The Tuskegee Syphilis Study isn't just a story about the past. It's a warning about the dangers of racism, arrogance, and unchecked power in medicine. By remembering these men, we honor their suffering and assure that nothing like this ever happens again. If you found this story important, share it. The more people know, the more we can protect the truth. And if you want to learn about other dark chapters in history, subscribe for more.